Hi, I'm Stacy Bancroft, FIT Certified Trainer and Licensed Clinical Social Worker. Today we are joined by Susanne Bargmann, who is an international trainer and speaker. And Susanne has a wealth of knowledge and experience helping organizations implement feedback-informed treatment and has graciously agreed to be here with us today and talk to us about some tips for FIT implementation in response to the current health crisis. So Susanne, thank you for joining us.
Thank you, Stacy, for inviting me.
Sort of what comes to mind about what leadership needs to know and be doing sort of in this time of complex change?
I think, first of all, what I notice with the agencies that I work with is that the current crisis has kind of stolen all the focus of the work and moved the focus to, the acute situation of moving services online, figuring out how all the technical stuff works. And it's also taken attention away from using FIT, using the ORS SRS. I've seen this in many agencies, and I mean, typically what we talk about is that wherever you were at in your implementation, you probably need to accept that you've been pushed back a couple of steps in your implementation. This also means that as a leader, you have to, that you're at that level you thought you were at, but you actually have to kind of go a little bit back in time and think about what was it we needed to do a couple of steps back to make sure that we were on track with implementing feedback-informed treatment and a culture of feedback.
Yeah, it's like everybody just sort of got blindsided by the shift and the reorganization that needed. Yeah. And now it's a nice invitation to say, like, wait a second, this thing that we really cared about that we thought was really beneficial, how do we get back to that and really sort of pick up as much as we can where we're at and reevaluate where we're at now and sort of how we need to proceed in this new context.
And there are a couple of things that, at least for me, come to mind when I talk with agencies. The first thing that comes to mind is that often the agencies are probably feeling that they're losing a little bit of track of why was it we did this in the first place? What's the benefit to the client? Why is it a good idea to use systematic feedback? So one of the things that is, for many agencies, a good thing to revisit, and it is actually also a good thing to revisit in implementations in general, but that's the question of why are we doing this? Making sure that we see the point, because if we don't see the point as staff, I mean, why should we even do this? Right. So helping people reconnect with what's the point of this. And another thing that I find is useful to revisit is what we sometimes refer to as infrastructure. It's kind of the key element of setting up implementation, is creating an infrastructure where it becomes possible for us to build implementation. And that means setting aside time for training, even small bits of training, setting aside time to review graphs and speak about what comes to mind, what hypothesis do we generate that might be useful to speak with the client about?
I think that the suggestion around reconnecting to like the value of it also blends really well with what you're saying around infrastructure, right? Whether that's in supervision, we're looking at graphs or having these conversations about why, or I know that a lot of agencies are still having team meetings virtually in some capacity. And so it's like those spaces still exist. And it's reorienting to say, like, how do we bring FIT in these FIT conversations and reinfuse them into the fabric of what we've been doing?
Exactly. And I think what leaders probably need to be willing to do, because I think this is the challenge as a leader of an organization, they need to be willing to kind of drag the group a little bit. So they need to be saying, let's look at the graph from this client, or let's set aside time where we return our attention to FIT. And it may need to be big and small. I find agencies need different levels of support for staff, just figuring out how to use this in an online conversation. How do we use the tools electronically instead of in the room with the person, for example?
What really comes to mind for me when you say that is the fact that it needs to be ongoing.
Yeah.
You know, like we talk about graphs often, or we revisit our skills about how to effectively invite this kind of feedback during sessions repeatedly. You know, we have written materials, we have videos we watch, we have conversations. We can even do dyad practice via something like Zoom between clinicians. It needs to be part of this ongoing thing, so that we can continue to refine our skills.
And I think what you're saying is actually kind of important, Stacy, because again, if we accept the fact that we've probably taken a couple of steps back in implementation, one of the things we may actually quite concretely need to revisit is how do we introduce the scales to clients in this format? How and at what time do I get the client to fill out the scale? Do I send a link in advance? Do I send it while we're speaking? How do I look at the graph and share it with the client? A lot of very practical things. And then I think just figuring out again, what would be the benefit in an online setting to me actually asking you specific feedback questions, figuring that out and making it more clear for people, I think is important if we want people to return to using FIT, even though they're in an online format.
What I like and I really appreciate about what you're saying is that it's so concrete and in some ways so simple, you know, like reevaluate what's been working, where we're at, and kind of what we need. Create spaces for staff to be talking about FIT, in terms of culture of FIT, but the practical realities of using the measure, and really concretely revisiting the why. Just like 3 very simple practical things that I think are a beautiful like starting place of how do we get back on track. Well, thank you so much for taking the time. We really appreciate it, and if we're lucky, we'll get some more time with you maybe in the future to talk more about implementation. Thank you, Susanne.
Thank you, Stacy.